we can use Cisco technology to help not only simplify the organization, improve upon your healthcare options for your patients, your healthcare providers, but also how are we going to learn from our other customers who've been using this. So we have with us today Jim Hyman, CEO of Ordr, a Cisco partner for over 5 years now. And as well, Larry Smith, our deputy CISO from Camino Health. And we're going to have a nice little chat about some of the things that we can learn from them and their experience with our Zero Trust.
So from an Ordr perspective, we are a connected device security company. We are also a very proud partner and big partner of Cisco's, whether it's Cisco ICE, Cisco Spaces, Meraki. We do a lot of integrations. We share a lot of data. And it's a great partnership for us, just given where they sit in the network and the type of data we're able to provide.
Today, what I want to really talk about is the devices. How many devices and MAC addresses do we see on that network that we have to protect each and every one? Now we're going to be getting into about 36,000 at that point. And that's how do we trust all those devices?
If you knew how many devices you have on your network, it's simple. It seems like a simple question, kind of how many devices, and not just managed devices, not just IT, like laptops, phones, etc., but all devices, anything that connects to your network. Not an easy question to answer, and we'll walk through that a little bit as we dig deeper. So as we dive in, if you look at kind of this slide, talks about all the different things there that we see when we're looking at a hospital. And so for those of you who have gone down a zero trust journey, the idea of zero trust very simply is that you trust nothing until you know what it is and you're able to profile it. So that's a hard problem. And if you ask 100 people at the show today what they mean by zero trust, you're probably going to get close to 100 different answers. And the one thing that everyone will agree on is it seems daunting. So when you all of a sudden have to go into a process where you have to identify every single device, not type of device necessarily, that as well, but down to a single device, it's a really hard problem. But that's a problem that when you start to tackle it, seems like it could go on a long time. And it seems very, very complicated. It doesn't need to be. And so I guess from my first question for you, Larry, is when you look at all of this, can you just define quickly for people listening when you mean zero trust? Like at El Camino, when you were on a zero trust journey, kind of what did that mean? Like what was the definition of it in your world?
So thanks, Jim. First thing about zero trust for me is I look at it not so much as a journey that we've completed. We're on the journey. We're, I'd say, pretty well into it, but it's not necessarily an end point. It's a continuous cycle of revalidating. Do we even trust our journey? So the idea is that trust nothing. If we start with, in this framework of the first columns of identifying and then protect. If I can't identify everything that is on my network or transmitting data in some way, shape, or form to the network, how can I protect it? So, and by identify it, I have to know what are those devices? What are they supposed to be talking to? What are they trying to talk to? Who are the users using it? So I have to go in deep on every single device. And then when you start thinking about 36,000 devices, well, how do you do that with just basic full-time employees? We're not going to get that done. We need help.
So I have a little inside baseball knowledge, which was when you first started doing this, it was really hard. And you said to me a while ago, you had kind of an aha moment where you all of a sudden looked at zero trust a little bit differently. Can you just kind of walk us through why it was so hard when you first started the journey and kind of what you did and kind of how you got to where you are?
Yeah, so when we started, we were looking at, with a primary user, the use case was we wanted to get down to the micro-segmentation. How do we help? So we use Cisco ICE for that. How do we get the policies right? And how do we know the devices are properly going into those policy segments? So we started with ICE, trying to do some profiling, along with the tool. We needed some additional information. That's where Ordr came in, started telling us what the devices are, and we were still struggling on the policy development. And my that is using Ordr simply to know what the device is. We have to go a step further with Ordr of understanding, all right, how do we visualize how those devices are talking? And that was the aha moment, is when we looked at the data to visualize north-south data in that flow. But the big one was when we could visualize east-west flow. So that way I know this device is properly talking to these various groups within ICE. And at that point, the second part of it is we started off with doing human interviews. We said, within clinical engineering, bioengineering, whichever group you have, Well, you tell us, that's how we started, what these devices should be talking about. Or, in this case, let's say blood gas analyzers. Should they be talking to any other devices on the access network? And they gave us feedback. We would build policy on that feedback, and then we'd try to run the policy, and that's when things would break. But the aha was when we led with that east-west visualization, when we could see the data, we would lead with that data, and then go back to clinical engineering and say, all right, this is what we think the policy is based on the data. And they say, oh yeah, we forgot about that. And we didn't consider that it should also be talking to these other areas. When we enforce the policy, no incidents to the help desk reported. And so the aha is visualization, north-south traffic, but east and west traffic as well.
So on Zero Trust, one of the things that I run into over and over is data. There's a lot of data, right? Everyone's giving you data. You probably have 20 different applications that you've integrated with either Ordr or ICE or some marriage of the two. Can you just talk a little bit about the idea of cleanliness of data versus just more data? So when you talked about this east-west traffic, was it just getting more of it, or was it making sure that everything you were using to make decisions was kind of clean?
Well, no, we definitely had to have clean data, and that's what's important. You can just go look at that flow, and it's not going to be useful just right out of the box. So for us, what we had to do is working with Cisco and some network engineers is to be able to have the appropriate SG or the security tags associated to that flow. And once we did that, and we allowed, for example, I'm going to use the blood gas analyzers to come back in, we could. And we're consuming about 1.2 terabytes a day of data just on that flow. That's a lot of data. But by having those tags associated to that flow at layer 4, the IP level, and we could look at it over time within a matter of just a minute of filtering through it. Now I can clearly see, I can visualize, I can bring in people who know nothing about network traffic and show them, this is what your group of devices are talking to. These are the other groups. They could see the names. They could visualize it, and they could understand it. And that one's what made the difference.
Hey, so just curious for people that are listening, can you just raise your hand if you're starting Zero Trust or have looked at Zero Trust or doing segmentation? Are people going down that road? So one of the things that I hear over and over is that it just feels like it's a huge project. And so, starting it is hard, I think. Can you just talk at El Camino, like, when you went through this, what advice would you give to someone who said, hey, I need to go down this path, but it feels hard. It just feels like it's going to take a long time to get to, you talked about the amount of data even you're saying. How do you start? So if I'm someone who says, hey, my organization, my healthcare institution, we need to do this, where do you start? Like, how would you tell them to get going?
Well, to me, as I look back, there were 3 legs to make this body of work function. Number one is I need something to tell me what's on my network. Yeah, I can go to my switch stack and get the IP addresses or the MAC addresses, whatever, of everything that's on the network, but it doesn't tell me what is it, what should I be doing with it. This is where that first part of the device classification is why it'll tell me it was rich data, what it is that is on my network. There are other security uses for that data as well, being able to know what do I own versus what's on the network that we don't own. But anyhow, the first leg is I got to be able to have rich data of knowing what's there. Second part, I got to have it for segmentation. I've got to have a policy enforcement engine. This is where Cisco ICE comes in. So those are legs 1 and 2. Using Ordr and ICE, I'm now able to build out policy, which comes to the third leg. There are different ways to tackle this one, and this is the data visualization. So with an Ordr, I can get the bulk of what I need for visualization, where I can see not just what a device is, and what is it talking to. And deeper to that, I can say, what groups is this device talking to? So from that, those 3 legs, classification, policy enforcement, data visualization is the third leg. That's how we were able to break it into segmentation. I will say, when we started this, we had those first 2 parts of where we were looking solely at what is the device, and then looking at trying to guess what the policy should be. That's where we were stuck. The moment we brought on that visualization, using what we could get from Ordr and into ICE, the floodgates open, so to say, and within 6 months, we had those devices segmented up.
Yeah, so when you say within 6 months you had devices segmented, you're the only person I've ever talked to who said the segmentation took less than 6 months. So it doesn't include the time you spent before that where you were trying.
So that's where the asterisk goes. So aha moment of, oh, this is what we need to do the segmentation. It was 6 months. We could have done it faster, but for us, based on the different policies, we allowed a minimum of 3 weeks per policy. And so it was just allowing time to go as we built it out for safety. But within those 6 months, I can count on one hand the number of incidents reported to the help desk.
Yes, the key. That's amazing. So I just encourage anyone who's listening, who's going down this journey, you should just come say hello after. I've seen a lot of our customers go after a zero trust. I'll another inside baseball thing that I'm probably not supposed to share, but you're the only customer we have in the world without a single support ticket that's open anywhere in the world, which is incredible to me given how far you've gone on the zero trust journey that you're there. But I also know it probably wasn't all peaches and cream the whole time. So if you had advice of the one thing you did that you think to yourself, man, I wouldn't do that again, what's that advice?
There are many different ways you can approach the policy, and we started off overly ambitious, where we wanted to go on a very device-centric path, where every device type we're going to have a unique policy to, which A, that's a lot of work. B, it's a lot of overhead. On ICE, it's not necessary, which then what I would say is, when you look at the taxonomy that Ordr, for example, provides, we can start high and go more on a policy-centric or a security-centric approach, which means fewer policies at first, and then as we tighten the security, get more and more towards the zero trust, we would have been done a lot sooner, and it would have been a lot less headache and a lot less testing.
Yeah, I think it's amazing. You know, the number one question I get asked probably as an Ordr employee is we have devices in our systems that we can't protect necessarily. We can't patch them. We can't afford to replace them. They're out of service. They might even, the OSs might be completely unsupported at this point. And so it's interesting talking to you about zero trust and kind of micro-segmentation, because it is a security solution at the end of the day of how to protect those devices that you just probably can't afford to replace. And so to that end, if you think about replacing it, the cost to replace them would be astronomical. I'm just curious, how high up the food chain at El Camino does this go? And so at the board, are they talking about segmentation? Are they talking about zero trust? Is the CIO involved? Kind of who are the players that are aware of all this stuff you've done and kind of what it's doing for the organization?
Oh, this absolutely goes up to the top. Between from our CIO, who's very much wanting to know what we're doing, how we're managing the segmentation, also understanding that not many organizations have gotten to this point. The CISO, along with the board, talk about it on a regular basis, and then it's those next steps of how do we make those big groups more dynamic and based on the current state of the devices. They want to know how we're going to get there, and that's where we're developing out now.
Yeah, I think it's great, man. I think for anyone who knows this space, it's not ending, right? The devices, we have a customer who's now introducing drones for delivery and things. So the devices are getting more and more rogue, as they say. So with that, I just want to, say thank you. Maybe I want to open it to see if